Raywat Deonandan is an epidemiologist and a professor at the University of Ottawa and joins us now on 680 CJOB. Thank you so very much for joining us.
My pleasure.
From your perch, what is that exclamation mark for you and what you see?
Well, the exclamation mark, of course, is the rapid rise in the number of new cases. We're in the growth phase of the pandemic. It was expected. And our goal with the isolation and the lockdown is to extend the time it takes for the cases to double. That's the doubling time. And if we extend it long enough, then we avoid having too many serious cases that overwhelm our healthcare system. So the exclamation mark, again, is the doubling time. We want to see that doubling time get longer and longer. Right now in Canada, it's, I think, 5 days. The global average is 7 days. We want to get that as long as possible, hopefully 10, 14 days.
Let's back up just a little bit. If people don't know what an epidemiologist does, what is it that you do?
Well, we don't work with skin. That's what everyone always thinks. It's not epidermis. The root word is epidemic. We study the determinants of disease. So if you read in the paper that the Mediterranean diet is heart healthy and shortens your or lengthens your lifespan by a certain amount, an epidemiologist figured that out. We look at numbers and derive wisdom and guidance from things that aren't necessarily biological but are deterministic in the population.
So you don't get to stick your head in the sand like the rest of us. We were sitting on 21 cases yesterday, and I was hoping against hope that we wouldn't see a huge spike today. We were up 14 cases and now stand at 35 because you deal with the hard facts.
That's right. And it's important to remember that the case load you're seeing now is a lagging indicator. That's because people who caught the disease won't manifest symptoms until about 5 days. That's the median length that we've observed so far. So recognize that the only returning travelers from abroad who are likely infected won't be counted in these cases for another 5, 7, maybe 10 days. So expect to see the cases climb. That doesn't necessarily mean that the public health investments have been ineffective. It just means it takes time to see that effect manifest.
Now, you had mentioned that this is doubling over 5 days. The worldwide average is 7. Now, we've got a variety of measures across the country to be able to deal with this. But my sense is as international travelers still come home, it's difficult to deal on that side of things. But now it's a matter of getting the handle on community transmission here. I'm not sure if this is a fair question, but are we doing enough from coast to coast to coast to try to get stretch that curve, if you will, to flatten it out?
The announcement today that travelers must be in quarantine for 14 days is the right thing. It should have been done at the onset of this crisis. And I believe lockdown is needed, not social distancing, not isolation, lockdown. And the reason for that is if you cannot interact with people, you cannot spread the disease. This disease is infectious before you have symptoms. So that's the primary way in which it's getting around. A study out of China suggests that 79% of infections were caused by people asymptomatic spreading it. So if everyone is not interacting with people that they don't typically interact with, i.e. your immediate family, the crisis can abate mostly within the life cycle of one infection, which is anywhere from 2 weeks to a month. That's why we're doing this. So to answer your question, are we doing enough? We're doing a lot. I don't want to second-guess public health, but the more that we can be doing is increasing our quarantine or isolation, even for people who don't feel sick.
We've been working on the honor system here, and I'm not sure if everybody's being honest, in other words.
Yes, and I understand that the government is implementing stricter penalties for people who break the isolation. I'm not sure if that's true or not, and it may come to that. So I believe the Quarantine Act allows the federal government to impose that sort of criminal censure on people. Hopefully it doesn't come to that, and Canadians are doing better than the Americans, I think. We seem to be following the guidelines better. But it infuriates me when I see people flaunting the need to be isolated because they're putting others at risk.
So you're blogging about, one of your blog posts recently was COVID-19. Give me some good news. So can you give us any good news?
Yeah, there's a lot of good news to be had here. I mean, at the social level, people are coming together like I've never seen before. a wartime effort almost. I've seen people be nicer now than they have been in months, which is fantastic. Also, as I like to say, there's an army of nerds coming our way. Several vaccines are being trialed right now. Many companies are cranking out potential treatments that are going through clinical trials, and several are showing some success. The WHO has a platform for a wide-scale series of testing on promising treatments, and they are making their way into hospitals. So your chances of dying if you get a serious infection are going down every day as these treatments make their way forward. As well, the good news is that if we do this right, if we isolate thoroughly and completely for the right period of time, according to my version or my reading of the data, is that we can get this down to a slow simmer of new cases in 1 or 2 months, maybe a little longer. In that case, we can return to some semblance of normalcy so long as we deploy an insane level of public health infrastructure that we can do at a fraction of the price that we're paying now in lost economy. So the good news is that this is not a health crisis, in my view. This is a health systems crisis. And a health systems crisis can be addressed with leadership, preparation, management, and investment, low-tech tools that we currently already have. So there is a way out of this if we navigate it appropriately.
Well, I hope you get to study the epidemiology of the niceness that remains after all of this is over. Thank you for being so nice to join us. I know it is your partner's birthday today. We appreciate it.
Thank you.